Hi everyone, hope this finds you all well. I am Dr. Christy Harder, just jumping on to talk about some questions that I generally get about how to shop for CBD. CBD is one of the most hot items in the supplement world these days, and I have patients that ask me all the time about what to take and how to take it and what to shop for, what to look for. So I thought I would just answer some of those frequently asked questions and just give you guys some really good information. So first, want to go over what is CBD. It's become a really familiar name to most everyone in the United States. CBD is cannabidiol, which is a phytocannabinoid that is contained within the hemp plant or the cannabis plant. And it has been proven to be safe, and it has been proven to be an effective therapy for many different conditions. CBD by itself does not get you high. It doesn't have any of that psychotropic activity that can cause that high effect. CBD and THC, which is the THC is the component of the cannabis or hemp plant that can make you high, but they actually act on different receptor sites, and they work in really diverse ways in the body, and so you don't get that same head high feeling from CBD that you get from THC. Another question that I get a lot is, if I buy CBD, does it always have to have THC in it? And the answer is no. There are ways that we can actually extract just CBD as an isolated form from the plant of the hemp plant. And that way you don't have to have any THC activity at all in a supplement or an oil that you purchase. A lot of times companies will choose to actually extract the CBD and the THC together using more of the whole plant for a more synergistic effect. This is usually called full spectrum or whole spectrum or broad spectrum. These are terms that were actually invented by the supplement industry to make something that was pretty confusing less confusing, but I think it's actually made things more confusing. So that question, what is full spectrum versus broad spectrum versus isolate? I get that a lot. So basically when a company is using the whole plant, so the extract of the whole plant, then that is considered full spectrum because it's got all of the different phytocannabinoids essentially in that product. There can only be, if it's sold in the United States, there can only be up to 0.3% of THC left in that end product, because that ensures that you don't get that high feeling. The isolate, on the other hand, is what I was talking about before, where you would take the plant and actually extract just the cannabidiol or CBD from that plant. And so if you're looking for a more broad effect where you're wanting the synergy of the plant together, then that kind of isolated product wouldn't give you that effect. You would have to get a full spectrum effect. But if you're wanting a higher dose of CBD, then you can actually get just the isolate amount, which allows you to have that bigger amount of milligram dose of CBD versus with the full spectrum, you would get that THC as well. I also get a lot of questions about what health conditions CBD will help. And there have been a lot of studies on CBD. The most effective that we found have been on anxiety, on sleep, on seizures, and on other neurological conditions such as Parkinson's and Alzheimer's. So when you're buying CBD, you have to look at the milligram dose, And generally the milligram will, the dose of the whole bottle will be on the outside of the bottle, and you have to divide the serving size up as far as how much the bottle contains in order to figure out what the dosage is for each drop or each dropper full of a supplement or the medicine. So hope this helps a little bit with some of those pressing questions that you guys have on CBD. The Dr. Hart's Botanicals tinctures all have CBD in them, and our dosage amount is 1,500 milligrams per bottle, which means that in each 2-ounce bottle you're going to get a 50 milligram dose. So hope that helps a little bit. Hope you all are well, and you take care.